So welcome everyone to the second of 3 presentations from our Washington Integrated Food Safety COE. My name is Beth Melius. I'm the Foodborne and Enteric Disease Program Manager at the Washington State Department of Health and also co-director of the Washington COE, and I will be your host for this session today. The topic for today's session is the role of environmental assessments in outbreak investigations. And before we get started, we wanted to let you know that this webinar is being recorded and will be made available for viewing later on our website. We will also make our slides available to you. If you registered for the webinar series, you will be emailed when the recording is available. So we're so pleased to host you all today. The Washington COE was established as a CDC COE supporting the western region of the U.S. and Guam in 2019. Our COE is co-directed by myself and Janet Baseman from the University of Washington School of Public Health. So today our training will focus on foodborne outbreaks, outbreak epidemiology, and environmental health assessment. This training is primarily for public health staff, both epi and environmental health, responding to foodborne outbreaks. And here are our learning objectives for this session. If you have any questions during our presentation today, please use the Q&A function in Zoom. We'll be monitoring the Q&A and we'll take questions at the end of the session. And with that, I'm pleased to introduce our speaker for today. Janet Anderberg is a public health advisor in the food safety program at the Washington State Department of Health. She collaborates with epidemiologists and food safety professionals from both state and local agencies. She helps to investigate, assess, and analyze foodborne disease outbreaks around the state of Washington. Janet provides training and technical assistance on a wide variety of food safety topics to environmental health professionals, industry, and other groups that are working to improve food safety. So welcome, Janet, and take it away.
Thanks, Beth. Hi, everybody. I'm really happy to be with you today. Today we're going to be discussing environmental assessments, which is kind of a newer phrase that used to stand for just environmental health investigations. And today we're going to be talking about how and why we do EAs, or environmental investigations. Normally, this topic is covered in a 3-day course, right? I've taught this course before, so this is normally covered in a 3-day course. Today we have 1 hour. So logically, of course, things will be much more of a high-level overview, and I will move through topics very quickly as we proceed today. So I will spend some time giving some specific examples to help illustrate key points. The foodborne illness data is where we're going to start today, and I'm going to talk about what data means to environmental health investigations, because there's a lot of data out there, and sometimes we don't always know how and when and where to use them. So that's an important part of what we'll be talking about today. CDC tells us that there are 48 million cases of foodborne disease a year. That's more than there is COVID, by the way. So there's a lot of foodborne disease out there. 128,000 hospitalizations. That's less than COVID, and 3,000 deaths a year. So this is CDC's telling us there's a lot of foodborne disease in our communities. And it's important that we know what to do in terms of outbreak investigations and how those are done. The type of pathogens involved in an outbreak investigations is really important for the field staff that are going out to do the environmental assessments to know what pathogen they're dealing with. I like to divide them up into some categories. So like the idea of a spore-forming bacteria, the reason we want to know that is that spore-forming bacteria can easily be killed by cooking. And so if there's a lack of a cooking step or there's a failure in the cooking, that affects things like that are non-spore formers like Salmonella and E. coli, Listeria, Vibrio. The non-spore forming bacteria, the control measures are completely different. We're looking for things like proper cooling and reheating procedures, and what you want to look for is completely different depending on what kind of pathogen you're dealing with. So identifying the pathogen of concern in any given outbreak is key to the investigation itself. The characteristics of those outbreaks are also important to know about. So what was the incubation period? Salmonella and norovirus, the two leading pathogens associated with outbreaks and illness in the United States, have similar incubation periods, and duration is where you might find the differences. So you want to talk about incubation periods, we want to talk about duration, and also symptoms that any particular cases have when you're doing this outbreak investigation. So it's important to get that information and share it and know what we're talking about. But in any given outbreak, when we're dealing with illnesses associated with food, depending on the pathogen, it could be something you ate a few minutes ago, a few hours ago, could be something a few days ago, or even a few weeks or a month or more ago. As you can see with the hepatitis and listeria tend to have those longer incubation periods. So when we're notified of the outbreak, the investigation work is different, knowing that there's been already a lot of water under the bridge before you get there. CDC says the two leading pathogens, norovirus and salmonella. This is straight off the CDC webpage this week, actually. I pulled that off of there. And 58% of norovirus, 58% of the outbreaks are probably, not of the outbreaks, excuse me, 58% of the illnesses associated with foodborne pathogens are probably norovirus. So if 58% of the illnesses are norovirus, we need to know about norovirus. We need to know how to investigate norovirus. We need to know how to do the field work surrounding a norovirus investigation. So that's something that we'll spend some time talking about today. Salmonella also one of the leading contributing factors, or excuse me, one of the leading contributors to illnesses. Clostridium perfringens is third on the list here, and it's right up there with salmonella. So there's a lot of Clostridium perfringens out there. And it's important to know about that, and we'll talk about that some more in just a second. On that same CDC page, you can scroll over and see that the number of cases that are hospitalized is different. So salmonella is now the leading pathogen associated with hospitalizations, and norovirus is number 2. So there's still 1 and 2, just in a different order. And Clostridium perfringens drops off the list altogether. So there's only the list of the top 5. So it drops off this part of the list. So Clostridium perfringens doesn't tend to be as serious, but we have a lot of cases of it. Then there's the deaths associated with pathogens, and salmonella and norovirus still, again, at the top of the list and of those that are causing fatalities with norovirus and salmonella. What foods are making people sick? I think that's a tough one, because most of the time the food that makes people sick is multiple foods. In fact, the data, we'll see some more data about that in just a second, but the data suggests that most of the time it's multiple foods. But when it is a single food, there's a lot of fish making people sick. That's this blue piece of the pie. There's a lot of chicken, a lot of dairy. The dairy, by the way, is primarily raw milk and raw milk cheese. The beef is primarily ground beef. So those are things to consider when you're wondering which foods should I concentrate on. These are the primary foods associated with foodborne disease. CDC puts out a report every year in their NEARS section that I think is really worth looking at. And the NEARS stands for the National Environmental Assessment Reporting System, and it's a complementary reporting system to NORS, the National Outbreak Reporting System. And NEARS keeps track of the environmental health features that are associated with an outbreak. So if you look on this chart, I know this is way too much words and too small to read, but there's a little pie chart down here. It says that nationwide, for the NEARS data that they recovered, 40% of the outbreaks were norovirus-related outbreaks, and 20% were salmonella in the last reporting year that they had, which, by the way, was 2018. Excuse me. But there's other things to learn from here. For example, just right next to this, you can see that the most common food vehicle nationwide was multiple ingredients. So, and it far surpassed everything else. Oysters were right after that, and almost the same level as chicken and poultry. So there's a lot of good information to be obtained from the NEARS reporting system data, and it's something that I would recommend you take a look at it if you get a chance. And if your state's data isn't in there, then at least look at the national data. We use the data to discover what the trends are. We can also figure out what went wrong in different cases and which pathogens are impacting which foods. We'll show some examples of that here in just a minute. But how the pathogens move through the kitchen, which foods are making people sick, what are the lessons learned? And the data really helps us to get there. Here's a case study. So there's an outbreak that most of us probably didn't work on because it was a national level outbreak that involved a food processor. And the food processor processed cantaloupe. It was in October of 2011. And there was a story in the paper about a gentleman who was 92 years old, and he got listeria and ultimately died from the listeria. But his wife ate the same cantaloupe that he did. And we know for sure it was from the cantaloupe. There's a lot of testing and traceback work that brought that to our attention. But only one in that family got sick. So the two people ate it and only one got sick. In that outbreak, by the way, there were 147 cases across 28 states. Of those, 143 people were hospitalized. So almost all the cases were sick enough to go to the hospital. That's an amazing statistic. 33 people died in this outbreak, so it's pretty significant. We didn't have any cases from that outbreak in Washington state, but a lot of the other western states did, and it's primarily in the center of the country. But lots of people got this cantaloupe and had illness. I think that there's some lessons to be learned from an outbreak that you didn't even investigate, right? Like that food can make people sick. There can be deaths associated with it and hospitalizations. That was absolutely clear in this outbreak. Listeria symptoms can be mild or non-existent or even life-threatening. You can get listeria from cantaloupe. Up until this point, we knew that there was salmonella in cantaloupe, but we didn't always know that we didn't have that kind of connection that listeria and cantaloupe were tied together. Attack rates of 50% are not uncommon with certain pathogens. Listeria is one of them. Those are all lessons. From the field, I think that we also learned that listeria outbreaks are really frequently linked to unclean equipment. So the idea of biofilms forming in equipment is where we're going to find a lot of listeria outbreaks. And I think that we also got to learn as a nation that equipment can be clean on the outside, but still causing problems because it's not clean on the inside. So we need to have a more holistic view of outbreak when we're doing outbreak investigations of what role equipment plays. Outbreaks can spread if they're not stopped. This went on for quite a while before we figured out, it's the cantaloupe, and then things were able to be stopped. Here's what I think is an important point, that this facility was just inspected earlier in the month before the cases started. And their inspection score, they got an A. They got a 95% on their inspection. So if they got an A and yet they had an outbreak and it resulted in 33 deaths, something didn't get caught on that inspection that could have prevented that outbreak from happening in the first place. That said, we don't always look for those kinds of things during routine inspections, but we need to look for those kinds of things during outbreak investigations. So a typical inspection, if the investigators would have just done an inspection at the plant, they probably would have given them an A again. It wasn't that they missed stuff, it was that they were looking for the wrong stuff. They were looking for stuff that was part of an inspection, not an investigation. So let's talk about those investigations. We do investigations so we can take some action. That's a really important part of what happens there. We want to alert customers. We want to stop the illnesses from happening if that's part of the profile. But we also want to remove contaminated products from market and improve the health of our communities that way. We also learn. So I've said this before, but the spectrum of illness and which pathogens do what to which foods and in what way, that's an important part of what we're trying to learn. Which vehicles transmit which pathogens, what contributing factors are associated with each pathogen. How can we prevent future outbreaks from happening? If we don't learn that from every single outbreak that took place, then the investigative work, we're missing that piece of it because that's almost always there. You almost always have something you can learn from outbreak investigations. The environmental investigation, or the EA, I have it here in the center of this diagram, but it can be anywhere in here. It's part of the process. It's tied with the epidemiologic investigation. It's tied with the laboratory work, and the whole result of this is we're trying to come up with a conclusion. So it isn't that EH and the environmental health folks do this investigative work and it's separate. It's integrated. It's part of the process. We're all working on this together. That said, I think you can kind of divide these investigations that we're doing, these environmental assessments, into two different categories. And the two different categories are processes that are done differently. So I want to talk about that. First, there's the traditional kind of an investigation where they're usually local. It's usually a restaurant that someone complains about. They call up and say, hey, I got sick from eating at this place. And you go out and you take a look at the food, the equipment, the process, the food workers. You find ill food workers and exclude them. You do food flows. You figure out contributing factors. All those things take place. We're going to go into that detail here in just a second. But that's a traditional model. And it's worth knowing that because the bulk of our investigations are of that model. But the second model, the contaminated product model, is growing in frequency right now, partly due to the idea that there's more whole genome sequencing taking place now, and we're able to find more outbreaks that are from this kind of surveillance. So the contaminated product profile is usually it's a multi-county or a multi-state situation where you're notified by the lab or the surveillance that there's something going on. You find source information. So you look at receipts and tags and invoices and try to figure out where did this product come from. You do traceback work. You consider how the prep work impacts the course of the outbreak, but primarily we're doing traceback work and trying to remove contaminated product. And then coordinating that work with state and local partners becomes almost the biggest part of the job, because for environmental health, because they're used to working with the restaurant and figuring things out with the restaurant. That's your big partner in the investigation. And when it comes to these contaminated product investigations, your big partner are the other states and sometimes the federal government in terms of your federal partners, in terms of coordinating things and making sure the investigation proceeds. Let me give you an example. In 2019, there was a salmonella outbreak affecting a number of states. 2 people were hospitalized, and the cases ranged over a pretty long period of time, January, February, March. We had cases on all 3 months. And of the folks that were able to be interviewed, there were sushi came up as a common food item, and specifically sushi that had tuna in it, not the ones with the crab or the avocado, but the ones with the tuna in it. So we did some traceback work with restaurants and grocery stores and suppliers. Ultimately, a recall was done, by the way. It was ground tuna that was the implicated product, and it was imported from Vietnam in 1-pound bags, sold in 20-pound boxes. That recall took place on April 15th. Remember, the cases were between January, February, and March. So when we finally got to do the recall, is it even meaningful? And the answer was yes, because the product was frozen and could have been in the freezers for another year. People could have continued to use it, and again, for sushi. So it's an important thing. Let me show you what the field work looked like. In our state, in Washington, there were 4 cases, and they were in 4 different counties at 4 different restaurants. So at 4 different food establishments. So the Washington did traceback at Department of Agriculture, and with the FDA partners, traceback happened. CDC was involved. 8 states were involved with their local health jurisdictions. 8 states were involved with health and state ag, and FDA was involved. The outbreak was finally declared to be over on May 22nd. So even though those cases began in January. So this is not atypical. This is fairly common for these contaminated product outbreaks, that they take longer and they're spread out over more time. They're important to be investigated, but they look different than a traditional kind of a norovirus outbreak, for example. I wanted to show you what some of the paperwork looked like. Because we have 4 different counties in this state, and 8 different states involved, there's a lot of different people doing piece of the field work, right? So this one was a food flow that someone submitted, and they said, this is what happens with the tuna. It's yellowfin frozen ground tuna, and it's delivered and thawed under refrigeration, except that sometimes they have problems with the thawing process. And the ground tuna is then mixed with the chopped tuna fillets, which that was something that hadn't occurred to people in other locations. That wasn't being done, but at this particular one it was. So we didn't know at that time if it was the tuna fillets or the ground tuna that was the problem. But there were bare hand contact problems, cross-contamination problems, and improper hand washing that was noted. Then that mixture was put in a cold holding unit, and oh yeah, it wasn't cold enough. So that was a problem. And then the spicy tuna rolls were made to order. Well, let's look at that. Let's look at what a spicy tuna roll is. So at one restaurant, they had they said, well, I ate a Paradise roll, a Yummy Yummy roll, and a 9/11 roll. And so they said, well, those are the things you want to check on. And first question is, well, what's in a Paradise roll? Well, in a Paradise roll, you might find some super white tuna, yellowfin tuna, cucumber avocado, topped with super white and some yellowfin, and then some fish eggs are going to go on the top, right? So in the Yummy Yummy roll, we've got yellowfin tuna and salmon, also some yellowtail and some white tuna, some albacore tuna, some red snapper. Anyway, as you can see, there's a lot of stuff going on. So we went, okay, this is a little bit complicated. But when we got down to it, then this key over on the right, you see that the spicy tuna was really the ground meat yellowfin tuna that was the subject of this investigation. The white tuna, however, and even the super white, neither one of them was tuna. It was escalar, which is an oil-based fish that's like, it's totally different. The red snapper, they said, oh yeah, we don't really have red snapper. That's kind of expensive, so we just use tilapia. So it's not the same. You know, if you say you have red snapper, you probably should be having red snapper. But when it came to yellowtail, which was what we thought was the implicated food, they said it's sometimes yellowtail tuna, but sometimes we use flounder, sometimes we use sole, or even amberjack. So just because it said on the menu that that's what it was, the only way we're going to figure this level of detail out is doing the field work. So this is part of the investigation. This is the sleuthing that goes on during field work, and it's a really important component of it. So let's talk about the investigation process itself. So as I said, we're taking kind of a high-level look at this, and we'll kind of whoop through this pretty quickly. This is the part that could take a couple of days of work in a normal training session, but be prepared, interview and investigate, do some food flows, find contributing factors, take samples, implement control measures, and report and share. Those are the basic steps. They're not all created equal, though. So some of these steps take a few minutes to do and accomplish, and some of these steps take sometimes days to accomplish, or at least hours. And so they're not all created equal. It's not a equal 1, 2, 3 kind of a process. Let's talk about step 1. Be prepared. Be prepared is like, of course, you start with your sampling supplies. Make sure you've got your ice chest and your ice, and be ready to take samples of all different kinds depending on your pathogen. But you also need to talk and work with your epi partner or your CD partner to know exposures, symptoms, incubation, duration, any common foods or lack of common foods. That's important information to have. Identifying a possible organism of concern. So based on the epi data, collaborating with the epidemiologist or the communicable disease partner that you have is really an important key to making the field work turn out correctly, to be meaningful, and notifying what kind of food, because we're not trying to do an inspection. We're trying to do something very specific for this particular investigation. So when we get there, so be prepared. So then when you get out there, you interview and investigate. Well, interview and investigate, we could spend a few hours talking about that because that's a big deal. But basically you want to start with at the beginning and figure out who did what, when, where, and how they did it. Are any of the food workers ill or any of the staff ill? You collect names, dates, places, procedures. We're looking for evidence as part of this outbreak investigation, and at this point we're not looking to see if there's any violations. We're looking for very specific evidence as it pertains to this investigation. When it comes to things like contamination, we want to know, how did contamination happen? If we're looking at survival, how did that happen? If destruction, why wasn't it destroyed? There's a lot of things to look at. You want to look at receiving and storage and prep. You want to look at equipment, cross-contamination. How did cooling happen? There's a lot of different avenues to look at. So you really need to figure out how to condense it down to make it meaningful for this particular investigation. I think questions like, how did the contamination get into the kitchen? That's an important thing to try to answer. How did it move around in the kitchen? So if it came in on some lettuce, how did it end up with the people? Was it not washed? Was it cross-contaminated? How else did it happen? How did it get to the customers? Maybe there was a server involved that's how it got to the customers. There's a number of those kinds of questions that you would ask that aren't part of a traditional inspection-based question either. And by the way, when it comes to that idea of how did the pathogen of concern get into the kitchen, a couple of years ago, I was looking at Washington data and thought, I wonder how did the pathogen actually get into the kitchen in this year? And in 1 year's time, this was where it was mostly brought in by food workers. Sometimes it was brought in by shellfish or produce or poultry, but most of the time it was brought in by food workers. So that's just a good thing to kind of keep in mind about how the pathogen gets into the kitchen. But of all the things in the investigation, I would say probably the most important thing to keep in mind is the idea of now versus then. And so this is a big part. Are the foods held at proper temperatures today? That's one question, right? That's the kind of question that you answer during an inspection, right? But during an investigation, you try to answer, was the food held at proper temperature a week ago last Tuesday when these cases ate here? So how could you possibly know if the food was at the right temperature a week ago last Tuesday? So this is where the investigation part happens. This is where the sleuthing comes into play, where you try to figure that out. So, I mean, it's good to test the temperatures today to try to figure that out, because you can go, well, at least today they were a good temperature, or today they were a bad temperature. That's an indicator. But that still doesn't tell you what happened in the past, like a week ago last Tuesday, or whenever the day was that the people were exposed, or dates for that matter. If the food's being properly cooked, that's a classic example. If you have someone cook for you, they say, I think your undercooked chicken may have made people sick. Can you cook some chicken for me? They cook it for you, and it turns out like this big hockey puck. It's like cooked at 200 degrees. So it may or may not be reflective of how the chicken was cooked last week when there was a rush on, and they don't use a thermometer anyway. So those are the kinds of things to look at to try to assess what's happening now versus what happened then. And it's the then that we're trying to get to. So, okay, I probably said this enough. An investigation is not an inspection. So let's look at this idea of food workers. So it's one thing to be asking food workers about, how did you handle the lettuce? Were you washing it correctly last week? But there's another thing to say, how was your health last week? So if you ask the manager of the restaurant, did you have any ill employees? And he or she, the manager says, no one called in sick. Well, most of the time, what we're looking for isn't who called in sick. We're looking for who didn't call in sick, but should have. So that's like, how are we going to assess that, right? So the manager probably doesn't know, because most people don't share that level of detail with their boss. Like, come in this morning and say, hey, supervisor, guess what? My poop is runny today. That kind of stuff probably doesn't happen very often. And as a result, they're in there at work. They didn't call in sick, but you may have had an ill or infectious food worker that was working. So how are you going to discern that? I think you need to have a private, separate discussion with them, not the manager, but with the food workers themselves. And this takes some time and some effort. So it's really worth doing it. It needs to be kind of separate from everything else that's going on. Food flows we've kind of already talked about a little bit when I showed you the tuna food flow, but it's really important that food flows be actual food flows and not theoretical food flows. So this is what a theoretical food flow looks like. The food is received, stored, prepared, cooked. This is not helpful. So this is how food is handled. So that's not helpful. Sometimes when I ask for a food flow, I get something that's similar to this. And what we're looking for is, how was the food prepared? Who prepared it? What were the challenges there? What were the risk factors that were identified there? What were the problems that were identified there? Were there any contributing factors identified, and in which steps? Was there bare hand contact at receiving, or was there bare hand contact in prep, or was it at service? And all those things are different and in terms of investigating the outbreak. So it's really important to include all of the details in the food flow. And why we're doing that is to find the contributing factors. So the contributing factors are what went wrong. So it's kind of the conclusion, really. What happened? What went wrong? And if you don't find any contributing factors, sometimes it's because it can't be found. It's just like, that was too long ago and it can't be discerned. But sometimes it's because we inspected instead of investigated. Sometimes it's because we didn't uncover the right rocks, or we didn't have the resources to be able to uncover the right rocks, right? I would recommend that most of the time when you find contributing factors is when at least two people are doing the field work. So that's a really important component. Contributing factors also need to be things that you know for sure went wrong. Like there's a broken refrigerator today and it was broken last week too, and all the foods have been sitting at 60 degrees for the last 2 weeks. That's a known contributing factor, right? Or you have food workers who said, yep, I vomited at work, so that's what happened. Those are known contributing factors, and those are kind of easier to find. The harder ones are the ones that you suspect may have happened. But so you say, oh, I can't insert things that are possible. You don't insert things that are possible. You insert things that are possible that have evidence, right? So you look for intermittent glove use. So they're wearing gloves when you get there, but how confident are you that they're wearing their gloves a week ago last Tuesday? And to do that work and to find out that, oh yeah, I interviewed someone once and they said, do you wear gloves all the time? They go, yes, all the time. And I said, how often is all the time? They said, more than 50% of the time. And I thought, okay, that's a good interview. You know, how often do you wear gloves? Is it 100% of the time? You know, and when? And because gloves all the time isn't a good thing either, because gloves can cross-contaminate. So that's its own thing. But food stored at room temperature, that gives you an indication that it's not the same food as it was last week, but maybe it shows a pattern, or inconsistent cooking temperatures, no thermometers. Those kinds of things can help you lead to what possible contributing factors might be. In our state, we look at the contributing factors every year, and more often even than that, but we try to figure out what are our big things that are causing outbreaks, you know, and this is a typical year, so I included this one. This is from a couple years ago in 2017, but it was nice, clear graph, so I'm using it. But hand washing and bare hand contact were 1 and 2, right? They were the leading contributing factors to outbreaks in our state. So we did extensive training for field staff so that during routine inspections, hand washing and bare hand contact could be the emphasis. Sanitizing of equipment was lack thereof was another key thing that we thought was really needed to be brought in. And cooking is often one of the least common contributing factors, but it was moving up in the ranks. And why is that? Is because we're having different kinds of foods that were being cooked. So when you look at that, it helps you kind of frame the risks. If you're doing risk-based inspections, frame the risk in terms of contributing factors. CDC put national contributing factors up. Again, this is from the 2018 data, but they said the #1 contributing factor to outbreaks in 2018 was foods just being eaten raw. So there's some value to putting consumer advisories on menus and making sure people have both the disclosure and the reminder of the health consequences. That could be a big part of a program if we know that that's one of the highest risks associated with foodborne outbreaks around the country. Also, hand washing and cross-contamination turned out to be big things nationwide as well. So we're looking for contributing factors and not just inspection stuff. But how you get to the contributing factors is if you have a focused inspection. So this particular handout is made available to you, and by the way, the resources for that are at the end of this presentation. But this is a document that was put together that helps you figure out what is the field focus. So if you take a look at this, and over on the left column, you can see some pathogens. So like these viruses, norovirus and hepatitis A, when you do the field portion of the investigation, the environmental assessment, the field focus should be on bare hand contact, hand washing, and ill food workers, because those are the contributing factors that are associated with those pathogens. If, on the other hand, for example, you've got a Clostridium perfringens outbreak, what should you focus on in the field? It's kind of the opposite of a norovirus outbreak, right? You want to focus on cooling, hot holding, reheating, room temperature storage, and any reduced oxygen packaging that may be being used. So focusing on cooling and hot holding is totally different than focusing on bare hand contact and ill food workers, right? You do a totally different set of interviews. You look for totally different set of clues in your investigative work. Salmonella and E. coli are spelled out in here, some parasites and seafood toxins in here. And each of these field focus items are further delineated in what the interventions are here in the center portion. And on the right are things you can do or to consider at least in terms of control measures or remediation. So this, I think, is a handy-dandy guide. I recommend everybody pull out this or something similar so that they have a field focus before field work actually takes place. When it comes to sampling, I'm going to give an example in a few minutes about sampling can make all the difference in an investigation, but only about 20% of the investigations actually use sampling. They're not always needed. So if sampling is beneficial to your investigation, know that food and environmental swabs are possible, but also stool samples from food workers are another good way to help figure out what the contributing factors are and how the control measures are going to be set up. Speaking of control measures, it's one of the things that's sometimes left out of investigative work is like, now that we know this, do something about it. So sometimes you tell people stop cooking like that. Take that off your menu. Modify these procedures. Sometimes it's like, this whole kitchen needs to be cleaned and sanitized, or you need to be closed. All these remediation things can be looked at. So I think that just reporting and sharing that information with others, as we mentioned before, is really important to the process, and we're spending some extra time in getting it right. Okay, I have a few minutes left. I want to give a few examples for you of epidemiologists and environmental health folks working together to solve outbreaks and kind of some of the lessons learned. First one's a listeria outbreak. It was a sushi outbreak associated with listeria, and the cases were spread out over a 2-year time period. And you think, well, how could you have cases over 2 years? And in fact, it was asked of me, are there any foods that would still be in a kitchen 2 years later? Like, could this really happen? So a similar facility was mentioned in the interviews over a 2-year time period. It's a small grocery store in a community that had a back room that made sushi. So is it possible? So we went out to take a look. What's been there for 2 years? What could possibly be the culprit here? So we looked at equipment. There was a lot of cracked and broken equipment. This is a piece of a rice holder where you did hot holding of rice, and it was broken, and it had been repaired with Scotch tape. So the Scotch tape wasn't enough to keep the moisture or the water or even the food debris out of there. So there was plenty of, technical term here, plenty of gook built up underneath there. So the slime, the biofilm layers that are collected there were pretty substantial. We also found some significant temperature control problems. They used time as a public health control for their sushi, which is very common with sushi. But so this was displayed in a broken refrigerator, intentionally broken. They knew it was broken. They said, oh, we're using time as a control. It doesn't matter. And so they put the time where it was to be discarded for 4 hours from now. So that was good. It was all time marked and date marked, except if you look closely, some of it was time and date marked from yesterday and day before yesterday too. So the whole time as a control thing was something they got the technical part of it right. They got the date and time put on the product, but it wasn't being discarded within that time frame. So that was definitely an issue there. And there was cloths that were used to line the rice cooker, and the cloths were just moved out. And I said, how often are these cloths cleaned? And they said, oh, you don't have to clean them. They don't need cleaning. And I thought, they don't need cleaning. What is that? So then I wondered about the rolling mats, the bamboo rolling mats here. And you can see there's different patina that's been established on these different rolling mats. And I asked about the frequency of cleaning of those, and they're bamboo with a little tie on them, and none of it is cleanable, and they don't even bother cleaning them. They said, no, we don't clean them. We kind of wipe them off with this dirty rag. So there's plenty of things there, and some of these had been used for 2 years, so that was part of the problem. So if you look at lessons learned, we learned that cold holding of sushi in markets is something to look at. Time as a control isn't a good fit for everyone. That's something else we looked at. We found that uncleanable equipment like rolling mats and cloths and even wooden utensils. There's a great big wooden mixing bowl in the sushi place. There was about 2.5 feet across. And I said, this is so big it probably doesn't even fit in a sink. And they said, yeah, we don't wash that. And I said, well, how do you clean it? They said, we wipe it out with a paper towel. So there's a lot of pieces of equipment that aren't being cleaned and sanitized. I also would say that another lesson learned from this particular outbreak is LM cases should be looked at over a longer period of time because you can get a lot of information there. Speaking of listeria outbreaks, there was one a couple of years ago that we worked on that was all the people that got sick had croissant sandwiches with turkey croissant sandwiches. And we were wondering what in the world, and the one thing that they had in common is the turkey had changed out over time, the lettuce and tomato had changed out over time, but they were using the same knife. And I thought, well, that couldn't do it. And the knives looked really clean. This is one of the knives. And we ended up swabbing the hilt of the knife, which is right where the the blade and the handle joined together, and found the listeria there. And the reason that this is important is I ended up asking them, why, so how often are you cleaning your knives? And I'm thinking that they're going to say every 4 hours, or something like that. And they said, well, we never put them in the dishwasher. We never put them in the sink, but we wipe them with this bleach cloth over here. And they don't wipe all of it. They just wipe the part that seems dirty to them. So so it never gets washed, rinsed, and sanitized. That's definitely something that could cause a problem. Now, if we think that norovirus is 40, 50, or 60, depending on which data you're looking at, % of the cases and or outbreaks, it's definitely something worth getting to know. The Kaplan criteria tells us that if the incubation and duration are in the 24 to 48 range, you've got both diarrhea and vomiting, and another pathogen seems likely, that you're probably dealing with norovirus and you should act accordingly. Well, what does accordingly mean? I think that accordingly means that you need to consider in every norovirus investigation that you want to find and exclude any ill food workers. You want to identify and remove or have destroyed any contaminated food. You want to clean and sanitize any surface that may have been contaminated. And I think consider closing the establishment to allow time for cleaning and to allow time for food workers to stop shedding if they're asymptomatic shedders, for example. So those are all things to consider. This doesn't always go this way because every outbreak is different, right? I found one that I thought was just classic, and I thought this is exactly how it's supposed to be investigated. This was at a golf course where there was a little a little cafe for the golfers there, and 38 people reported illness after eating at this cafe. The incubation, duration, and symptoms all matched norovirus, so it was a Kaplan criteria kind of an association, and there was no particular food. They ate breakfast burritos, sandwiches, salads, wraps of all kinds, Bloody Marys, all those kinds of things. The environmental investigation found, remember you're supposed to focus on ill food workers, bare hand contact, and hand washing, right? That's the field focus for norovirus. They found 2 ill food workers. They found that they indeed had bare hand contact, and oh yeah, they weren't washing their hands at all. So that's an issue. And then they did a closure. They excluded the ill food workers. They had some food destroyed. They did required some cleaning and sanitizing, did follow-up inspections, required an educational training session for all the staff, and they instituted a risk control plan with the operators. So the question is, was the norovirus remediation procedures followed? Yes. This is it rarely follows it to the T like this, but this was done exactly how you would expect a norovirus investigation to go, and it happened perfectly. Doesn't always happen that way. We just had an outbreak investigation last year of norovirus that the interviews found 11 ill food workers that had worked in the kitchen while they were ill. That's just crazy. So getting in and doing some intervention work is really important with norovirus outbreaks. Here's a case study on a perfringen outbreak. It was a large party. This is before social distancing, right? So there was a large party of 480 people attended this big picnic, and 237 of them reported illness. We had 3 people willing to submit stool samples, and it was confirmed Clostridium perfringens. 4 cases visited the doctor. They did extensive interviews with 104 people. That's a big outbreak investigation. And it turns out it was an spinach curry catered from an Indian restaurant, and there's a history of temperature control problems at this facility. I would tell you that this is a picture of the kitchen, and this place was kind of a mess, right? So this place was a mess. So they were immediately closed. But when you're looking at a Clostridium perfringen outbreak, the field guide tells you that your field focus should be cooling, reheating, and hot holding, right? Those are the kinds of things. Well, the hot holding at the picnic was kind of non-existent. The reheating was questionable, and the cooling was what the bulk of the investigation centered on. The cooling was found to be done in these 5-gallon plastic buckets. We think we don't have much of that happening anymore because so many people are getting better at shallow pan cooling and different types of cooling, but indeed this was problematic cooling. This food was still warm, and it was more than 24 hours old, so it was still warm in the refrigerator. And that's a key indicator. And it's clearly not cooled anywhere else. You can see a solid layer on the top of these containers that shows that this is how it was cooled. Plus, we asked the operator, how did you cool it? He said, I took it off the stove, put it in the bucket, put it in the refrigerator. So this is clearly how they cooled it. That's a problem. A lot of people got sick. And that's how a big outbreak can happen. So they said they only did this though when they had a big group, and this was a big group, but they often have big groups. So that's something to look at on routine inspections. It's also something to zero in on outbreak investigations. We had an E. coli outbreak associated with a Mexican restaurant a year or so ago, and we couldn't figure it out because all the foods that were consumed were hot foods, and E. coli is one of those non-spore formers that you can destroy with cooking, and all this food was thoroughly cooked. In fact, their hot temperatures were really hot. They were hot holding in 170, 180, 190 sometimes. They were really hot holding this stuff, and that wasn't the problem, so we couldn't figure it out. So this is a picture of me in the gray shirt. I was sitting in a storeroom individually interviewing food workers about their diarrheal status, right? And one of the co-investigators came in to me and said, Janet, look what I found in a refrigerator. And I said, where did you see that? We didn't see it before. They said it was in the employee lunch refrigerator. And I thought, what in the world is it doing in there? And there was a whole bunch of illegal raw milk cheese, and it was stored in the employee lunch refrigerator. And I said, are you using this for employee lunch? And they went, oh, yeah, using it for that. They weren't. I interviewed another food worker, and I said, why is this cheese in there? And they said, we put that cheese in there because the health department never opens this refrigerator because it's for employee lunches. It's labeled employee lunches. So it's part of the investigation is to look in places where you're not normally looking, right? So I'm going to wrap up my storytelling here. And by the way, I think there's a lot to be learned from storytelling. In addition to being just, oh, that's an interesting story, I just think that there's things to be learned, things that you can apply right away to your job when we do these lessons learned kind of thing from outbreak investigations. There was a salmonella outbreak a couple of years ago where they had multiple foods, no one food in common. There were no ill food workers that were reported. The restaurant was clean. It was nice. It was had a good inspection history. Their temperatures were good. Their cleanliness was good. Their cleaning and sanitizing was good. So what caused the illness? So we went out to take a look a little closer. We decided to have sampling play a role. So we ended up interviewing all the food workers, and four of them declared that yes, they'd had diarrhea while they're working. And I said, you just told the manager that you didn't. And they said, yeah, well, I wasn't sick. I just want you to know I wasn't sick. And I said, but you had diarrhea. And they said, yes, definitely had diarrhea, but I wasn't sick. And okay, you weren't sick. We tested those four food workers. Two of them tested positive for the outbreak strain. It was a salmonella, by the way. It was a salmonella Seftenberg, and two of them tested positive. One of those was the food worker who assembled the meat slicer. So we tested all kinds of other things there too. We did environmental swabs. We tested handles, drawers, cutting boards, counters, sinks, drains, all kinds of stuff. Everything tested negative for salmonella except the meat slicer. And we went, why the meat slicer? Because it was a composite sample. We didn't know what about the meat slicer caused the problem. So we went back and said, set that meat slicer aside. It tested positive. We're going to come back and do some specific sampling. So we sampled the handle and the carriage and the place where the meat sat and all the different parts. And then we thought, I wonder what's underneath those screws, right? So we looked at where the handles were attached. This is the picture of the meat slicer. It was very, very clean. When we unscrewed the screws, this is what we found underneath. And the one on the left is this from that meat slicer. And those food scraps had gotten in underneath because the silicone seal had degraded over time and allowed food scraps and water and moisture to get in. It formed a biofilm. We tested this biofilm, and it tested positive for the outbreak strain of salmonella. So, and then we found that almost, I went to more than 24 others in that same chain and found it on 100% of their meat slicers. So this was another example. We had many. I took a lot of pictures. There were many examples. This is very common. And I'm going to go back. This is a clean meat slicer on the outside that was oozing out salmonella from the biofilm underneath the screws because the silicone seal had degraded. So checking on the intact nature of the silicone seal here and here, on a routine inspection may have solved that problem. So that's something to learn from that particular outbreak as well. And the salmonella matched both the food workers and the customers that were ill. So in conclusion, I would say that there's these two basic kinds of investigations that we do in environmental health. One's the contaminated product investigation that was highlighted, I hope, for you with the tuna example and with the cantaloupe example. And again, whether you investigated it or not, that type of outbreak investigation is completely different in terms of sourcing and finding out how things happen and what the contributing factors are than the local investigation. So that the local investigations, you look at equipment and ill food workers, you look at cooling, you look at some source things as well. Environmental health should do investigations. I'm hoping that's really clear by now. And investigations are hard. They're complicated, and there's no one way to do it because every kitchen's a little bit different, right? There's a huge difference between how the chains operate and how a mom and pop place works, how a great big place works, and a place that serves a couple dozen people a day versus a couple thousand people a day, right? It's a big difference in terms of volume and how the investigations proceed. But the environmental health investigation should include what were the contributing factors, that's what you're working to find, right? And then also to apply the control measures. So those are the two key features that we're trying to do, is identify the contributing factors and apply the control measures. I believe strongly in the idea of learning from outbreaks. I think they all have a story to be told. Even a boring one like the golf course outbreak story, that's a boring story. Like everything happened exactly, it was nothing crazy or weird about it. You know, it was just, that's how norovirus happens. But I'm telling you that there's a lot to be learned from that. I think that we should be looking at those kinds of examples to learn our lessons. It changes how you focus your routine inspection work as well. It should, because this is the goal of the routine inspection, is to prevent an outbreak from happening in the first place, right? That's why we're doing them. So it's really important to learn when one happens and how we can apply that information that we just learned to any kind of routine inspection as well. And when we learn, the data, looking at the data is super important because it helps us to learn what's happening, and ultimately that's how we save lives in public health, right, is to know the course of disease and how to prevent it from spreading, how to prevent it from happening in the first place. So I care about this a lot, which maybe you can tell, but the part that I work on mostly is the environmental investigation. The epidemiologic investigation, just as important, if not more so. I mean, these are things that need to work together to be able to come out with a conclusion. So that's what we're after here, is an outbreak is being, some light is being shined that maybe there's an outbreak here. We look into it using our resources in EPI and EH and in the lab, and we try to come up with some conclusions so that we can both stop it and learn from it. So I hope that something in there is something that you can use and move forward with. There's a number of tools and resources that I mentioned today, the CDC information. There's also some really good training that's part of the EAT series. Last time I checked, which was a week ago, I was planning to check this morning and ran out of time, but a week ago the EATS training was still down. And I don't know if it's back up and running again. I talked with CDC recently, and they said that they should have it up early to mid-November, so I'm assuming that's now. So if it's not up now, it will be up soon. And the EATS training is really, really quality training that you can take, and I highly recommend it. It's virtual learning, and it's really good. The National Environmental Assessment Reporting System, also known as NEARS, is something that if your state's not currently enrolled or participating in, there's worthwhile. It's a little bit of work to get in, but there's a lot of benefit to working with that. And even if you don't submit your data to NEARS, I would recommend that you look at the NEARS data and see what there is to learn from that, because there's a lot of good stuff in there, and same with NORS. And then the Center of Excellence Toolkit is posting the toolkit that we mentioned before about the field guide, so that's in there as well. Okay, I think we've reached the part where we've got 5 minutes left. If there's any burning questions, I'm here.
Great, Janet. Thanks so much. We do have some questions in the Q&A. So if anyone does have questions, please ask them in there. I answered a couple of them that were about if the webinar, if you can watch it again. Yes, they are being recorded, and you will get an email after this webinar with a link to the recordings. So let's see. I'm just going to read you a few of these questions. Great presentation. Do we believe the new EATS course will be released this month? Are there previous trainings we can take?
CDC said that they had a glitch. It's been a glitch for several months now, and they said they hope to have it up mid-November. So I'm hoping later this month they'll have it up and going. It's probably the best training that I've seen on this topic.
Okay. Elizabeth has 2 questions. Do you have any thoughts on incorporating root cause analysis methodology in the investigation? Like, why did the contributing factor happen?
So as part of the NEARS program, we look at antecedents. And so that's a question that we're trying to answer. Was there a sick leave policy that was awry? Was there no paid sick leave? Was there a problem with lack of equipment? Was there a problem with lack of staffing? What were the antecedents that caused what are the root causes, right, to some of these issues? Is there a lack of training? That's something that should be looked at on every single outbreak investigation, is try to determine that so that is something that is being tracked right now and through the NEARS system. So that page that was displayed earlier that showed the NEARS data, there's a whole bunch of that root cause kind of assessment that's on the second page. So that's something that I would encourage you to look at, is to look at all the data. But there's going to be more data that comes out of NEARS as well. I would encourage other states also to look at collecting statewide data to see what the root causes are in your area. In the Seattle area, they looked at paid sick leave and when and where that was being implemented and how, and now that's required currently in the Seattle area to have paid sick leave for all food workers. And so far, that's not tremendously impacted our data, because even though we thought that was a big root cause, is that they don't have paid sick leave, so they feel like they have to come to work. What we were finding was they were coming to work so they didn't let their coworkers down, not because they didn't get paid, but because they didn't want to let their boss down or their coworkers down. So there's more than one reason why different things happen. So it's worth exploring so that we can put control measures in place. So yeah, I think it's a great thing to look at on a everyday kind of a basis.
Okay, another question. Do you conduct after-action reviews or hot washes? If so, do you include this in a written report?
I think that those are super important. So the written reports here in Washington are all over the board in terms of how they're done. Sometimes the counties write them. We write a paragraph or two for each outbreak every time they happen here at the state level, so that we've got some sort of a recording of it, so to see what happened with it. But the hot washes with the people that did the investigative work is super important, because not only do we learn from their outbreak investigation, but they learn even within the staff at the same office. You know, 2 people went out, but you got 6 health inspectors in your office. They need to know this stuff too. They need to know what could I have done differently to make this investigation go more smoothly. What should we have done? And there's so many things to learn from that. I think that the very best investigations are the ones that include the hot wash. So if you have an option to include it or not include it, I would include it every time.
Okay, a couple people are asking for the environmental assessment that you, like a copy of that. Is that in our Neuro Toolkit?
I believe that are we talking about the field guide?
Yeah.
Yeah, I think that's one of the Center of Excellence has that document.
Okay, we'll make sure that is available as well. Another question, because identification of the pathogen is so important, then why is it that medical professionals, it's so difficult to convince them to test stool samples? It's a good question.
Yeah, because their goal, from my perspective, their goal is to treat the patient, not to do the public health work, right? So they're a partner in this, but that's not the only way we can figure out the pathogen of concern, right? So that's why the Kaplan criteria comes into play for norovirus. If it looks like norovirus, even if you don't have laboratory support for that, it's probably norovirus, and you should treat it like that. I would say the same thing applies to Clostridium perfringens. If your incubation's in the correct range, the duration's in the correct range, you have the right symptoms, and they ate the right kinds of foods, you know, pre-cooked and cooled foods, I think you can pretty well consider that it's Clostridium perfringens. So identifying the pathogen of concern doesn't have to be through lab data. That's easier when you do. It's way easier. But try to figure out what kind of categories it fits in, because even if you don't know for sure if it was perfringens or Bacillus cereus, for example, you're at least in the same category of pathogen. If you don't know if it's Salmonella or Campi, well, it's in the same category of pathogens, so you can still do the targeted field investigation if you can get even close to what kind of pathogen you're dealing with.